For the breastfeeding video, I talked to my friend. She's a first-time mother. She gave birth about a month ago, and one of my first questions was, did you have any misconceptions about breastfeeding before you started? She didn't really know a lot about breastfeeding before she became a mother, so during her pregnancy she was researching a lot. So she said that initially she thought if you have mastitis you cannot breastfeed from the affected area, but the maternity nurse and also from all her researching and reading said that it actually helps with the movement of the breast through the ducts. But obviously it depends if the mother is okay with that, because sometimes it's too tender and too painful. So she learned a lot when she was looking through websites such as La Leche League, and also from her midwife. Number 2, what are the implications of your cultural background and advice from friends and family members towards your choice for breastfeeding? She comes from a Chinese background, and they have a lot of rules regarding after birth. So they want to keep the body warm, which means she's not allowed to have any cold food or beverages. Cold foods include cucumber, watermelon, cantaloupe, pineapples, raw vegetables, and cabbages. She also told me that her mom makes her a lot of fish soup because they believe that it encourages breast milk production. Number 3, what struggles or barriers did you have to overcome when you were starting to breastfeed? Did you have any issues producing enough milk? So she said she struggled initially with her baby latching, but the maternity nurse coached her through it, and her advice was to line the baby's nose with her nipples, and from there they will instinctively bring their mouth up to the feed. She didn't have any problems with milk production. In fact, she wanted to pump so that she will prevent mastitis. Number 4, did you find enough support or resources to guide you through breastfeeding? She said she was very lucky that her family was very supportive, especially her mother. And also her midwife was telling her a lot of information, and also she got some information as well from the La Leche League website, which she really find very useful. And so she was able to incorporate her traditional beliefs with the Western ones. What I could have done better in this video, I could have asked my friend more about what her coping skills was, because I know breastfeeding can be an emotional time and stressful time because your body's going through all these hormonal changes, and as well as dealing with the transitional changes of being a new mother.